My name is Chizea. I'm here to do a gastric sleeve procedure with Dr. Okaro. I've been on a weight loss journey for quite a bit, dating back as maybe 10, 12 years ago. So I've tried quite a lot and yo-yoed in my weight. My first shot was like a Cambridge kind of diet, which actually worked a bit, but of course I put all that back after a while. And I did try the Ozempic for about 3, 4 months, but I didn't see much progress because, well, maybe it was my setting. I was in Canada at the point and it was winter, so I didn't get the benefits of external exercises to go with it. And I did drop that. So I decided to come on this journey to, take me to my desired weight target. So far, I've been on the pre-op diet for about 2 weeks now, and I've gone through the regime that has been prescribed, and so far, I think I've lost about 8 kg just on that procedure alone.
To get his
Morning.
his letter. Yeah, okay. So okay, I'll sit on this. Chukuka.
Yeah. All right. Good morning, everyone. So this is day one post-ops. I still have my cannula on me. I guess they'll be going out in a minute before I get discharged. I'm all dressed up and happy to go home. So it felt like a minute actually. I remember having a chat with Cherise and the doctor just before the procedure started. I went under anesthesia and it felt like 1 minute and I was out. A bit more discomfort than pain, I would say, throughout the day / the night. They have a lot of stuff to check and monitor you. I've got stuff strapped on my legs, strapped on my hands, And I remember joking with someone. I said, those guys who run away from hospitals, now I give them some respect. There's no way I could have escaped. Yeah, so I went through the night. So besides the discomfort, the internal discomfort, there's also the throat kind of bringing out some phlegm kind of stuff. Nothing out of the ordinary. So you have
So thank you for coming in to have a chat with us. I think for the audience, just to put it in the context, so you had your surgery
on the 16th of September. That's Tuesday last week. And today is Friday. So
yeah. So that's 10, 11 days.
Yeah.
Sleeve, was it the lap sleeve we did?
Yes, gastric sleeve. Yeah.
And what was your weight possibly before surgery?
So the minute I walked in here, just after we had the virtual consultation, yes, I weighed in at 152. On the date of the surgery, I weighed about 144
kilograms.
Kilograms, yes, exactly. Yeah, and as at this morning, I saw 136.
So that's a significant reduction in time from when we chatted and when you had surgery. It wasn't that long.
No,
I think we're looking at about
6 weeks.
Yeah, so we're looking about 6, 7, 8 weeks now. Yeah. Okay, 7 weeks. So how do you feel?
I feel great. Awesome.
Happy you had it done?
Yes, I did. I'm so happy I did it. I think I've turned the bend, so I'm looking straight to the finish line.
And of course, for patients that don't understand that, I know we talked about how the triggers for you to have made the decision to have surgery, obviously, maybe you can highlight them again, the big triggers, the reasons.
Yeah. I can't stop saying, talking about quality of life. It was so painful to see myself not wanting to do the things I enjoy doing, some outdoor activities. I couldn't stand for long. I had a terrible back ache. I was very selective of where I could sleep or the kind of mattress I could sleep because of that back ache. And if I take it into the family side, this is a bit personal. My wife is a bit on the very active side of things and really couldn't stand seeing me sliding down the ladder, I would say. And she kept talking me into doing something about this. I've tried practically anything anyone will try before getting to this step, and it's either it works and I see myself coming back to where I was, and this time around I said to myself I needed to do something for good. Not to also mention the kind of things that I would say, I don't want to call it shame, but on one occasion I felt a bit pained. My kids were still very little then, but it's like, oh, I'm coming to pick you up from school, or I'm coming to your school for something, and they're not really happy you coming around because maybe other kids would laugh at them, or they're not proud of seeing their daddy the way he is, or whatever it was. And I think all those things rolled up into that big decision to come and do this.
Yeah, well, I mean, of course, thank you. The last was a very personal, I think, sort of feeling, and I thank you for being open about that. I have a lot of regard for you. I have a lot of respect. And I'll just kind of mention the biggest reason. You see, we as men have traditionally been a little bit insular. We live in a little bubble. We don't like to talk about and address issues. And I think doing this to me as your surgeon is a direct maybe action that you are doing for yourself to benefit your quality of life, and I think that's very courageous. And I want to commend you for that.
Thank you.
I also want to thank you for speaking, talking, talking to the camera. A lot of people are shy. A lot of people are scared. Judgment. We don't like to be judged, intrinsically. And I think that's courage. And I think you're a very courageous man. And I'm so, grateful that you've done it. But also, I'm hopeful that you will, get everything you want from it, for you and your family, and of course your business.
Yeah,
so
absolutely.
I want to thank you for that. And it's a very touching story, that. So I must say. But I think you're a very courageous man.
Thank you.
I must acknowledge that. Thank you.